technically, by the guidelines, we should be using estrogen alone in people without a uterus because we're
Right.
not concerned about that endometrial protection anymore. As you alluded to, there are a number of benefits that women will have with using progesterone therapy. I'm curious to hear a little bit more about your personal practice. How do you decide when you might be more inclined to offer it versus not offer it?
There's actually a few subset patients that I absolutely always use progesterone when I'm using estrogen for menopause hormone therapy. For women who've had a history of endometriosis and those women who have had hysterectomies, for example. So technically, yes, they can just be on estrogen alone. I always use progesterone in these women as well. There are women who can get recurrence of their endometriosis symptoms if they're on estrogen alone. The mechanism of action in regards to endometriosis as a disease process is that it feeds off of estrogen. So if you give estrogen alone, you can have that risk of that happening for a woman who's now postmenopausal on hormone replacement therapy. There are times actually in early perimenopause where I will just use progesterone as well. So going back to sort of looking at the stages of perimenopause and sort of that early transition period with regular menstrual cycles and a lack of those estrogen deficiency symptoms, really more of a focus, like you alluded to, on potentially a shorter cycle, a heavier period, worsening PMS symptoms with more rage, water retention, weight gain, then sometimes actually cycling progesterone during this time can be a really helpful aid. As we get older and our ovulation is, not functioning the way that it used to, then it's not that production of progesterone isn't as robust. In regards to sort of the standard patient of perimenopause and menopause, even if they don't have a uterus, but they're having, significant anxiety issues falling asleep, progesterone can be a great aid for helping with falling asleep, initiation of sleep. Estrogen tends to be better with sort of that waking during the night that women will have, but progesterone can be really helpful with falling asleep. It activates the GABA neurotransmitter in the brain, so it's really calming. It has a kind of a natural calming effect. That being said, there's about 10% of women who actually don't respond well to progesterone. And with that, it's sort of this paradoxical response where you'll give them progesterone, they'll call you the next day and saying, I was up all night, I was anxious, I was ragey, I'm a mess. If you're one of those women who's going through it and you're like, oh, my friends love progesterone, it's not a one size fits all model.